demographic health survey that was done in 2013. So if you look at the 39,000 people, it gave us the prevalence rate of 2.1% of the entire population. And then when you try to look at the number of adults compared to children, we have like 26,000 adults living with HIV and 3,000 children. For male and female, we have 22,000 female towards 14,000 male that are infected with the virus in Liberia.
Is the number, this number, does that mean that we are gaining some level of success against the fight, reducing, the infection rate?
Yes, because basically before we had like over 40,000 people infected, but now we had like decreasing, coming down the ladder. Yeah, because 10 years ago we were like the new infection rate. Now every year we are expecting 1,900 people to get infected newly with HIV, but before then it was like 2,001. So we have reduced the rate of infection. But if you look at as I said, the female towards male, we know that more women are being tested than male. Men to go to the hospital to go do their test is not easy. But women always go into the hospital to do their tests. So they are more infected than male.
Okay.
Yes.
Okay. So let's talk about the impact of this COVID-19 on HIV/AIDS.
But before that, I have to go to give the entire update on the current year.
Yeah, go ahead.
So if for the number of counties, we have 15 counties, right? So if we come to the high burden HIV counties, we had 3 before. We have Maserati, Mount Gibby, and Grand Bassa with the highly hit HIV counties. But from the recent study done, we have other counties being added. We have additional 6 counties being added. Like Nima is a bordering county between other countries.
Okay.
So Nima is being added. Pong County, you have Maryland, the southeastern, River G. So there are 9 high burden and high prevalence counties that are infected with the virus.
Yeah, making it to 6 now.
Yeah.
6 counties.
Actually, it's 9 counties.
9 counties.
Yeah.
Okay. Okay. Yeah. So what's responsible for that?
Concerning the
infection, new counties coming on board, with the infection rate?
Because based on the studies that have been done, maybe Dr. Tume can come in to add to, because they are the one responsible for the clinical aspect of the entire response.
Okay.
So Dr. Tume, can you just...
Yeah. Let's come to you, Dr. Tume.
Okay, thank you very much for the opportunity. The Liberian Demographic Health Survey in 2013 states that we have about 9 high burden counties, and the 3 highest, as she said, are Bon, Mesare, Magibi, Maserati, Grand Bassa, followed by Southeastern B, Maryland, Grand Cru, River G. Then we have Southeastern A, you have Grand G there, River Cess, Sano County. Now, in terms of population, you have Nimba, you have Bon County, and you also have Lofa County. But in terms of prevalence among the groups or the general population, these 9 counties, according to the survey that was conducted in 2013, are the high burden counties. One of the reasons has to do with the population.
Okay.
Another factor has to do with the lifestyle, because you have, especially in Maserati, this is where you have all of the activities taking place. You have people in terms of social activities, you have a lot of people, social events taking place in these, especially Maserati, Grand Bassa, and Magibi County. If you go to the southeastern counties, you know that these counties are bordering Ivory Coast, and the prevalence rate of Ivory Coast is higher than that of Liberia. And there's cross-border marriages, cross-border trades, and what have you. So because of that, you have people moving from one country to another country. So this is increasing the prevalence rate. Another reason is because we had the civil crisis. We had people leaving the country to go to other countries, and then they came back because some people were engaged in risky behavior. They contracted the disease. So they came back, not knowing that they had a disease, they started to spread it to other population. Another reason why this virus is spreading is stigma and discrimination. People who are tested positive because of stigma, they are afraid to disclose. So they are knowingly infecting other people. So
afraid of being tested.
They are tested, they are positive, but they don't want to tell somebody that I'm HIV positive because they are afraid they are going to be stigmatized at the community level, in the homes, at workplaces. So they are silently infecting people, and the virus is spreading over time. As she said, our prevalence rate to date is about 2.1%. But from the survey that was just completed by June, July, we may have a new prevalence, which will tell us whether the prevalence is reducing or is increasing or is at a standstill.
Because it's been 7 years now since the...
Yes, it's supposed to be done every 5 years. But it has been 7 years, so you have people still engaging in risky behavior with all of the awareness and messages being given out to people. They are still engaged in risky behavior. People receive condoms.
And we say risky behavior is on safe sex.
Yes.
Okay.
Unprotected sex.
Okay.
Even though people come for condoms on a daily basis, but there's no way to measure whether the condoms are being used. You do ask, the person will tell you, yes, I use condom. But in reality, you don't, because you are not in a bedroom with the person to know whether he or she is using condom.
Yeah. So, I mean, these are just some of the reasons for the prevalence rate. And now, let's basically now look at, I was asking about the impact of COVID-19 on HIV. Just shoot us through that.
Okay, I think for the impact, that COVID-19, as we heard from other partners, that it also affects people at high risk, like people with HIV and AIDS, people with diabetes and other illnesses. And they talk about how the ages, older people, but now it's not like that. But the impact of HIV as it relates to COVID-19 is like it affects HIV based on their immunity.
Okay.
Because when you have low CD4 count, the immunity will drop, and then you are susceptible, meaning that anything can come. So the issue of TB, when you talk about someone who is HIV positive, it's possible they come down with TB, so they call it TB HIV co-infection. So once you have that lungs problem and other diseases that will reduce your immunity, it's possible you can come in contact with HIV or coronavirus.
So like other medical complications, AIDS, those living with HIV, they are immune to that. Well, we'll come to you, Dr. Sanko. Just give us a background of the department.
Let me just give you a point of correction first. I'm Muna Sanko.
Okay.
I'm not a doctor. During the war, we had the security sector reform that was reformed, and then HIV was included in part of that package for Liberia, like other countries. So I run the HIV program under the security sector reform in the Office of Security Cooperation. So I work there as the program manager for that particular program, but work directly with the armed forces of Liberia. And we want to proudly state that when it comes to HIV and AIDS and security sector reform, the ASL is far gone. There are a lot of gains being made in our area under the security sector reform. And with the uniformed personnel, they're doing extremely well when it comes to prevention, awareness, sensitization with other population, as well as the uniformed personnel.
Okay.
And so that's where I fall in. Okay, just to give you a little background of why we are here at this point of time, is to say that just as Mrs. Cooley was saying, our Honorable National AIDS Chairman, she was saying that it affects the immune system, yes. And we have in the body T helper cells that we also call CD4 cells. And when we say your immune system has been compromised, we are saying that the T helper cells that you have in the body, because of the HIV virus, has been compromised. It suppresses this. It increases the virus, increases in the system. The CD4 cells goes down. That is what's supposed to be helping you in your body to fight out any outside infection coming in. So if you're talking about the background with COVID, we're saying that even though this is HIV that we're speaking about, but your immune system is also compromised as the same as the COVID-19. So what we are seeing with people who are HIV positive and have advanced HIV disease, have uncontrolled HIV disease, have unstable HIV disease, because they are not really consistent with the medication, or the word to use there is that they are not adhering to the medication, taking it as they should, and getting their supplies and taking it daily as they should, you are also exposed to any outside infection that hits the immune system. So what we are saying to them that is we like recommending, and we giving pieces of advice that you should be on your medication. There should be no break in the chain of your medication in this period or this time of COVID-19. So stay on your medication.
Wow.
Yeah.
Now, so I mean, in a instance where, I mean, those living with AIDS do not adhere, to their ART, what becomes of that?
Well, there's no known. This is a new disease, just from 2019. There's not much information giving us to whether people living with HIV, uncontrolled HIV, has diverse symptoms or signs coming out as compared to the general population. Okay. So not much is known in that area. But what we say here is that because your immune system is already compromised, you stand to get infected with any other disease that affects the general population, so, including this.
Yeah,
let me come in. Besides COVID-19, if the person is HIV positive and the person is non-adherent, that person is predisposed or to developing opportunistic infections. When we talk about opportunistic infection in HIV, we are talking about conditions that when the person is healthy, a person will not come down with those conditions, except where the person's immune system is weakened and is broken down. Then those organisms have the opportunity to multiply within the body and cause diseases that are normally not supposed to occur within an adult. Let's take, for example, thrush. Thrush occurs within babies up to 1 year old.
Right.
But once the immune system is compromised, especially those who are HIV positive, they come down with either oral thrush, which we call oral candidiasis, or they also come down with vaginal candidiasis. So these are some of the conditions. Once the person is not taking the right medication, the right dose, the right way, the right time, that person will develop opportunistic infection. And besides, if the person is not adhering, there's a high tendency of the person developing resistance to that particular, let's say, virus, developing resistance to the drug. And we are supposed to conduct HIV drug resistance survey, and funding is the issue. But we know that from what we have done several years ago, there are people who have not even taken the ARVs, have already developed resistance to 1 or 2 classes of ARVs. So these are some of the factors, even though COVID-19 is just arriving and HIV being around for almost 4 decades. These are some of the things that predispose them to having, if exposed to the coronavirus, they may have conditions that may lead to other death, also because of their immunocompromised state that they are in.
Okay. And let me quickly add here that remember now, COVID-19 has a lot of respiratory illnesses. We're talking about like cold, common cold, the flu symptoms. Yes, and if you're not even careful, you can go into respiratory difficulties. So we're talking about that. But you also have in HIV, it's also a virus. And you also have people who come down with respiratory difficulties also. And not only that, but you also have HIV positives that are also diabetics. HIV positives that are also hypertensive. So all of the underlying health conditions that we're talking about in COVID-19 are also possible in people with HIV.
Experienced today.
Right. So what we are saying here, you are not completely isolated as an HIV positive person when it comes to these respiratory difficulties caused by virus. And also COVID-19 caused by virus. So this is the reason why we are here to send an alert to the public, particularly to all of our clients, that yes, you need to remain on your medication.
Madam Cody, has there been a clear-cut, plan formulated or developed by the National AIDS Commission amidst this coronavirus?
Yes, just 2 weeks ago, we came up with a press release informing the public that mostly our patients, that once you are positive of HIV, you need to be very careful, as we just stated, that your immunity will reduce. But then some of the issues we cover preventive measures, though we know that coronavirus is in Liberia now, and then as much we want to reduce the spread of HIV, we should be very alert that we should not forget or neglect our treatment. Because just to clarify to the public concerning the common way of understanding when you're not taking your HIV medication, what will happen is, like, for example, if you are like having a war in the country, and then you are like having your soldiers, once you stop taking the medication, because once you take the medication, your viral load is suppressed, meaning like coming down, it will be weakened. But if you stop the medicine, it gets more activated, more active, and will overpower your immunity.
It becomes a problem for you.
Yes. So anything, it takes opportunity. Other thing takes opportunity to enter your body to destroy your immune system. So what we did at National AIDS Commission is to inform the public that with all of the measures we put in place from CDC, WHO, and the government of Liberia on the different preventive measures, that we all should follow those things. And most to add up to wearing of masks, washing of hands, at the facility level, we want to strengthen the triage system. We will do a proper screening of our patients, keeping social distancing and physical distancing among our patients, and making sure that they be prioritized in getting the medication on time. Because the medication is lifelong. We have to take it every day, though it's free of charge. But that's something that we need to make sure that all of our health authorities are involved, that making sure that all of the facilities are supplied with the medication.
And I mean, that's where I was coming to. So it means that you've intensified, things you used to do before, you've intensified them because of the outbreak. Yes,
that's what we did. And another thing to add to the preventive measure are two things. Like even the setup, the telephone, the cell phone, we need to be very careful. We should not share our telephone with others, because we say it's in the air, it's a droplet disease, right? It can be spread through droplets. So it's important that we should not share our telephones to inform our clients. And also the changing of money or handling money, we should always use our hand sanitizer or wash our hands after handling money, because it's important that we keep ourselves safe. And for all of my patients living with HIV, we want them to adhere to all of the preventive measures being put in place to keep them safe.
Well, Madam Sanko, you've been talking about the importance of taking your medication, but what extra, importance it takes for persons living with AIDS to remain on the antiretroviral therapy?
Okay, that Mrs. Cooley said that right. When you adherence to the HIV medication, that is taking it constantly, regularly, and at the time it's prescribed for you, visiting to have your supply regularly, what it does there, your CD4 cells in your body, your helper cells, are increased to fight out, like Dr. Tuma was rightly telling you, any opportunistic illness that enters the body. Your T helper cells, they will fight it out eventually, making you, not too vulnerable to all other kinds of infection. And what it does, that too, consistently taking your medication, it boosts your immune system, so that your immune system is so good and is not compromised, allowing other outside illnesses or infections to come in. And that is why it is so important at this time that we say stay on your medication. And another thing it does there is when you frequently on your medication and you regularly on it, your resistance to these drugs will not, it remains the same. You are not resisting any other medication like your first line drugs that we have in country. Regularly taking it makes you good to stay on the medication, but if you're not regularly taking it, you become resistant to all our first line drugs. Dr. Tume can even come in with that.
Okay, to add up to what you have just said, taking the antiretroviral drugs help to build up the immune system, because the virus suppresses the immune system. So once the person is initiated on the antiretroviral drugs, there will be time they will have severe illness. Then after that time, because the immune system is trying to build up, so they will have severe illness. And then after that, they start to recover, and that person becomes normal and healthy again and go about their normal life. So if you are taking your ARVs regularly, that is the right dose, the right time, and the right way,
Right.
your immune system builds up, the viral reduces, and if you do the viral load will be suppressed. And that means you are not able to transmit the viral to another person. So we have this slogan that we say you equal you, meaning undetectable equals to untransmissible. So if the person has been on the medication for a period of time and they are adhering to their medication, that person automatically is supposed to have suppressed viral load, and once the viral load is suppressed, that person is unable to transmit to another individual. But in a case where the person is non-adherent, the viral load will increase, and at times you repeat the viral load test, it will increase, and once you have repeated viral load test done and you have increment in the viral load, I mean the person has failed on the first line regimen and you need to switch the person to second line regimen. And knowing very well that all of what we get for HIV is from donors. It's from donors.
Yeah, right.
We try to make sure that our clients take the medication properly so that we don't have a situation where we have a huge number of drug-resistant HIV in country. In country, we know that we have few cases, even though we have not done survey, but from our clinical investigation, we know that there are people who are failing on their first line and they are being transitioned to second line treatment.
Which is coming on the donor side, you want to avoid what you call donor fatigue, right?
Yeah.
You don't want donors bringing in the funding and then you're not showing the statistics that you ought to be showing, that the curve is actually, reducing when it comes to the virus, and then, you're producing what you call best practices in your
Because
country.
the donors want you to make
They want
progress.
to make
they want to
progress.
see
They want to see
impact.
best practice. They want to see best practices. They want to see impact being made on your HIV, situation. So donor gives you bring in the money, and then you're responsible for making sure that your statistics are being improved on, meaning you're reducing the HIV burden in your country. It tells the donor that you're doing extremely well. So not staying on your medication, like Dr. Tume is saying, is not a good thing, because you could build resistance, and then all of the first line drugs, you can take them anymore. They have to keep putting you on second line, which is now a good practice.
Madam Coley, it's one thing to talk about, take your medicine, be on the drug,
Right.
but it's another thing to scale up the provision of drugs at the various health facilities. Do we have them available?
Yes, indeed. We have medication available at the CMS, the Central Medicine Store. But now we are working with the NACP to ensure that all of the facilities that are offering ART services, the HIV services, we receive all of the drug in stock. Right now we are talking about the multi-month dispensing,
Right.
where at this particular time they will have like 3 months supply of medication. And then they will be looking at the community. They talk about differentiated services. I think she will talk about it more, looking at supplying most of the facilities from the facility to the communities that will have easy access to the medication based on this environment that we're in now.
Yeah, go ahead, Dr. Cabo.
Okay,
Community facility supply.
Yes.
Okay, for this situation, this is not something new for the National AIDS Control Program, because we experienced similar thing in 2014 during the Ebola crisis. And you know that it's almost the same thing, no close contact and all of that. And as I said earlier, our patients are immunocompromised, so they need to stay away from the streets, from crowded areas. So what, as a program, our strategy is to make sure that these people receive about 3 months and more drugs to be able to stay away from the facilities, from the streets, and be able to get their medication on time. So we've been working closely with our partners that is supporting the supply chain, and also with the central medicine store, to ensure that commodities are distributed to facilities that are providing HIV services in the entire country. For the counties, commodities go to the depot, and then they are distributed to the last mile by the county health team. Counties have received their commodities. In Mosurado, the distribution is done directly from the central medicine store to the facilities. So we have been pushing over the last 2 weeks since the announcement of COVID-19 in Liberia. We have been pushing the CMS to make sure that the supplies of sufficient medication to the facilities, so that all of our recipients of care can receive at least 3 months, at least 3. So those who are very, very adherent and those that have suppressed viral load can receive up to 6 months. She talked about the differentiated service delivery. Differentiated service delivery is the non-traditional way of doing things. Traditionally, everything is done at the facility level. What we are saying now is we have what we call group pickup. Maybe you have a group of 6 or group of 10, where one person will come to the facility, collect all of the medication for those 6 persons or 10 persons, and carry it and distribute it to them, so as to avoid them crowding up at the facility level. We also have what we call support group refill, where you have maybe a facility has a support group and they meet on a regular basis. The clinician goes there, distribute or refill these HIV patients also, or recipient of cares. We call them, right now they are not patients. They are referred to as recipient of cares, of care, because they are no more sick, they are well, they are going about their normal duty, so they are recipient of cares, they are not patients. So you don't refer to them as patients or clients.
Because
so they collect their medication and they go and give it to them. And in this situation, there are some clinicians who are really, really passionate. They collect drugs, take it to the patients who cannot make it. Right now, you know that things are increasing on a daily basis. Transportation is hacking. Gasoline situation is not easy. So these people are people who are not able to get to their facilities. So as the ministry arm in the HIV response, we are doing everything possible. And at the program level, for emergency situation, we are going to have medication available at the program level, where when, like, God forbid, we don't want this to go out of control, where people will not be able to leave their homes, or people will be afraid, like Ebola, they now want to go to a facility, will be able to come to NACP offices to be able to access their medication.
Do you have a database of you say we should call them
clients?
Clients. Do you have a database of the clients?
Yes.
Okay. You can easily communicate to them if you make some supply, if you dispatch.
Yes. We work closely with the network of people living with HIV.
Okay, Madam Sanko, what do you think, given the situation, you think what really Liberia needs right now, to fight to fight AIDS, to continue the treatment for clients?
Okay, so what I would say first that in the initial state with HIV, and I'm speaking, strictly with HIV, the messaging that came out, there were all messages that came with the scaring, scare tactics. Okay. I remember before they had this big, huge looking shadow over people who were HIV positive and scaring people, oh, HIV is real. And they had like, even the writings they had about it was so scary. But the whole thing, it was a death sentence. The situation has changed all over the world, globally. There's no scare tactics again with HIV. HIV is like in other countries, like you go and have a malaria test done. That's how it's done in other countries, right? And so people get their supply, and that's it. So we need to restructure the messages that go out to the public, and let them know that this is just another disease that can be prevented. The beautiful part about it is a public health concern, but it is preventable. And so all of the preventive measures that you're supposed to have to put in, like risky behavior, that is why the military, the AFL, has a very strong and robust HIV program, because the prevention measures there are so much in place. They have trained counselors, HIV counselors, that run the program. Even right now at the barracks, we are doing the differentiated services. We are not allowing clients, she said we shouldn't say clients, we call them ROC, recipients, to come in and collect the medication, but we go out in the community and not giving it. There are trained counselors that are assigned there right now, plus a nurse supervisor that dispense the medication right out of the gate. And so there's no discrimination about it. It's not stigmatized. And the beautiful thing about it, you were asking me how to, in the nation, how to, do it. Integrated services, and it's the way forward too for this, where we integrate HIV programs in all order, in the antenatal care, in the nutritional area, in all of the other areas or departments in the health facility. We integrate the HIV service so that nobody knows you are there for HIV. It's like any other illness you went for. You receive your services. The service providers provide you those services along with other patients that are there, so you will not stigmatize. So Liberia is, yes, we're doing a lot of, we're making gains in those areas, but there's still much more that we can do. Especially when it comes to stigma and discrimination.
Yeah, you want to talk about stigmatization?
Yes, the other issue, as she really said, that HIV came to Liberia in 1986. The first case of HIV was diagnosing a woman from Lofa County also hospital. The issue were, those days there were no medication, so that once you get HIV, you say death sentence. So based on that, the stigma on people were too much. So from that time, with the involvement of other partners coming in the country, we say it's no longer a death sentence. But now to just stigmatize people, to get rid of that thinking of stigmatization is very wrong. We need to all work together. Togetherness is the key. That would like to go out there, inform people that to stigmatize people, to start pointing hands at you. HIV cannot get HIV from touching someone or from eating the same pan. It's something like it's in the blood. It's in the blood. And also the thing we talk about risky behavior. We are not encouraging people to go out there and have the different ways in which people can get HIV. So we should start stigmatizing people in our communities, based on the healthcare workers also at the facility level. We should not stigmatize our patients, because who among us had done the HIV test? No one knows their HIV status. So we're encouraging everyone to get tested for HIV. And when it comes to coronavirus, you need to know that you are high risk. The only way you can know that you are HIV positive or not, you have to do your HIV test. And the test is provided in all of the facilities free of charge.
Are people already accepting to do their tests?
Yes.
Yeah, people are accepting.
Yes, there's acceptability in terms of HIV testing. Especially what we notice when we go to the community to conduct community outreach or mobile testing, you have people opting for testing. Or, because of maybe basic schedule, people don't want to come to a facility to do testing, except where they are very, very ill and the clinician deems it necessary for that person to be tested for HIV. But once we go out into the community, there's a huge turnout of people coming to do the HIV test. And this is another way of differentiated testing, where you do mobile testing or targeted testing. As she said earlier, male, we are not saying the male are not infected with HIV, but they are not coming up. They are not coming up for testing. So we want to move out.
And that's risky.
Go to workplaces, encourage, talk, because most of the ministries are part of the HIV response. As she said, they are responsible for the multi-sectorial response. NACP is responsible for the health response of HIV. So there are the different ministries. You have HIV decks. You have HIV decks. You have somebody who is responsible to disseminate HIV information. So we want to use this platform maybe once or twice a week, visit various ministries and be able to do voluntary counseling and testing for people. If you are tested positive and you start your treatment early, the possibility of living longer is high than when you come in very late at the advanced HIV stage, where it has to take about months to be able to stabilize you before you start to gain your immunity. That can take a long time. So
let me just add, Liberia is want to look at it, the cultural, background to here when we speak about diseases. Okay, so you're talking about why males are not accessing our testing facilities. Look at the culture we find ourselves. This is a predominantly male society. Women, you will find them basically in the hospitals all the time with their kids. You see it in schools, in the educational system, you see that working. You see it also in the health facility working, where the women take the initiative, take their kids to the hospital, they're checking up on the school. So this is a predominantly male society. They are not accessing, and we want to use this time. So we are looking at strategies to put in place as donors too. Are we talking about all male, clinics where they can go and get tested? Are we talking about, like Dr. Tume is saying, that those are all strategies, taking it to the offices where males can access, our testing, we're all having to come to the health facilities to get tested. Another area we should look at too is the 90-90-90 goals. 90 means the first 90 says 90% of your population already know the status. 90, the second 90 says those that know the status are placed on medication if they are positive. The third 90 says those that have been placed on medication are virally suppressed. Okay. Because when you virally suppress, of course, then you're saying that you are not going to be transmitting the virus easily to some other people. So there's so many, intricacies when it comes to HIV and AIDS. But like I say, we're going to get there.
Yeah.
Yes, okay, let me just add what you said concerning the male
Before
testing.
we take course.
Yeah. So for the ministry, agency and commissions at the national level, at the National AIDS Commission, we have a technical working group that we have meeting with all of the HIV focal person at the various desks, ministerial desks, and we meet on a Monday basis to discuss these issues. But we're encouraging men to get tested. You can just call us and come to the facility where they can do the HIV test.
Right.
We'll come over and just go into your offices and get tested. It is important.
Yeah, like the COVID-19, the more you test, the more you are likely to confirm.
Yes.
The more you confirm, the more you
right.
initiate treatment. Yeah, so let's take some calls. 0776 089 713. 0776 089 713 0880 514 096. Let's hear from this first caller. Good morning. Good morning.
Yeah, good morning.
Good morning. What's your name?
My name is James Salome. I'm calling from Viacom.
Let's hear you.
Yeah, firstly, I want to say thanks for the speaker.
But it's important, if you are on your medication, it's important that you also seek help for other underlying conditions, superimposed infections. While your viral load continually remaining high, she can help you. She will send you to a facility. So I will turn over to her, since she's one of the experts in treatment, care and treatment, so that she comes out with something.
Yeah.
So to respond to the questions, the first question, you talk about facilities in Mosoralo, where they are. So we have about in health we have about 7 districts. In each of the districts we have not less than 5 facilities providing HIV services. Currently we are sitting in Pinsville. In Pinsville we have Hope for Women providing ART services. We have Dupo Rural Health Center. We have ELWA. We have Pipeline Clinic. We have Benedict Manny. We have German Liberia Clinic. These are all facilities. We have Omega Community Clinic. These are facilities right within Pinsville that are providing HIV services. And if you go to Central Monrovia, most of the health centers, the big facilities, they are also providing HIV services, Redemption, Cali Hospital, JFK, SDA Cooper Hospital. These are facilities. Greystone, Star of the Sea, Claratown, Bishop Collins, Barbara, and you name it, Barnesville Health. So both private and public facilities
the rest of the counties
in Mosorado are providing HIV services.
Yeah, alright. Tomorrow, hey, the sun is gonna shine, yeah. Listen now. Everything's gonna be alright now, yeah. Everything's gonna be alright, yeah, alright now, yeah. Right, everything's gonna be okay, alright. Keep your heads up to the sky, yeah. Hey, since your night seems so long, yeah. And you don't know which way to turn, yeah. They could promise to let you down.
Hey, yeah, kudos music. I the confidential baby, humble. This whole is little a globe containing 7 continents, different country people, color, and different languages. Children of Adam and Eve, we are all one people. Why don't we understand this and put our hands together and fight?